Hi everyone, today we're going to discuss with you the importance of a vascular assessment and the outcomes it can have on the podiatrist and patient. A vascular assessment involves picking up on symptoms highlighted by patients and monitoring their ongoing vascular status in the clinic. Symptoms for a vascular assessment include smoking, hypertension, diabetes, hypercholesteremia, breast pain, reduced nail and hair growth, and cool to touch skin. In a vascular assessment, the podiatrist would perform a Doppler to give information about the blood velocity and volume in the vessels. They check the pulses, usually dorsalis pedis and posterior tibial, perform an ABPI to measure the blood pressure of the ankle, and a TBI to measure the blood pressure of the hallux. Of course, this can depend on time constraints, but all options are preferred. Podiatrists play a very important role in conducting non-invasive vascular assessments in the lower extremity and monitoring these conditions. The assessment itself is very important, as for example, peripheral vascular disease patients are often asymptomatic. In a study conducted by McDermott and colleagues, it was found that an ABPI value of less than 0.9 resulted in doubling of cardiovascular mortality and morbidity in patients, and conversely, a value of greater than 1.4 is a predictor of cardiovascular mortality. However, patients with these results may have no symptoms. Not only would a low or high ABPI indicate poor vascular health, but also the secondary complications in the foot result in decreased blood flow, decreased healing time, thickened nails, and possibly loss of sensation. Therefore, ABPIs, along with full vascular assessments, can help to paint a picture for clinicians of the overall vascular status and specifically the vascular status and potential of the foot. Healthcare-associated infections are the most common complications in hospitals in Australia. There are around 200,000 each year. As outlined in the Podiatry Board of Australia, guidelines for infection control is an integral part of the profession to ensure effective infection prevention and control. The Podiatry Board of Australia follows the guide of the National Health and Medical Research Council Australian Guidelines for the prevention and control of infection in healthcare. These guidelines in summary outline hand hygiene, personal protective equipment, handling and disposal of sharps, routine environmental cleaning, transmission precautions, droplet precautions, airborne precautions, and multi-resistant organisms as areas of most concern. Each area is then further broken down and outlined. It is a requirement that all healthcare professionals are aware of the issue of healthcare-associated infections in Australia, understand the chain of infection and the different modes of transmission of infection in healthcare, have a basic understanding of a risk management approach to infection prevention and control, and are able to identify potential risks of transmission of infection in the delivery of healthcare and decide what measures they should implement. When completing a vascular assessment, it's imperative that the podiatrist aims to minimize the risk of infection for both themselves and the patient, using the 5 movements of hand hygiene before you touch the patient, after the procedure, after body fluid exposure, and after touching the patient's surroundings. Using gloves and other protective gear is also necessary, especially if the patient has open wounds. The instruments, such as the Doppler, should also be sterilized using an ISO wipe or other alcohol wipe. Before the patient enters the room, all surfaces, such as the chair, bench, and the podiatrist's chair, should also be wiped down. Legal implications. As defined by the Podiatry Board of Australia, informed consent is a person's voluntary decision about healthcare that is made with knowledge and understanding of the benefits and risks involved. When performing a vascular assessment, although non-invasive, a clinician requires the consent of the patient. The podiatrist conducting a vascular assessment must also ensure the patient understands what the vascular assessment entails and how it will be performed, so the patient is informed and can give consent. If informed consent is not gained, the podiatrist is liable and can be prosecuted. It is also important to document and keep your health records accurate for the good care of clients. It is vital that the records are factual, up-to-date and legal and legible, outline the whole session, and can be understood by other professionals. The records must be kept for 7 to 10 years and made at the time of the event or as soon afterward as possible. The patient doesn't necessarily have to do anything to contribute to the infection control of the podiatry clinic and podiatrist, the Podiatry Board of Australia, in conjunction with the Australian Health Practitioner Regulation Agency, also known as AHPRA, provide resources to educate patients on the base standard of infection control standards that should be upheld by the podiatrist, and contact details if the patient has concerns regarding those standards. In line with the legal implications outlined earlier, for the podiatrist to be given informed consent to conduct the vascular assessment for the patient must be able to have full knowledge of what the podiatrist wants to do. For the patient, this means they must be capable of understanding the podiatrist and the benefits and risks of the assessment. In the case where someone is not able to do this, a parent or guardian may be able to consent on behalf of a child, or in the case of disabled people, a legally approved primary carer may be able to consent on that person's behalf. By informed consent being given for the podiatrist to conduct their assessment, the patient has agreed to the podiatrist's assessment, and including any adverse events that may happen during or as a result of the podiatrist's explained assessment. Another legality related to this is the exemption of the podiatrist from legal liability of the patient's self-treating or follow-up if a positive result is discovered. For example, if the podiatrist discovers something they deem important and refer or recommend the patient to a doctor for further investigation or vascular testing, the podiatrist is not then liable for any adverse events as a result of the finding. In that case, the patient did not follow the podiatrist's advice. For the podiatrist conducting a vascular assessment, baseline infection control must still be followed as outlined by the NHMRC. Relevant infection control modes would be hand hygiene. The patient would still be required to conduct the appropriate 5 moments of hand hygiene. To reduce contact transmitted mode of infection control. Routine environment cleaning would also be conducted both on regular environment sites, treatment chairs and benches, and the instruments used during the assessment to reduce cross-contamination between patients. The Podiatry Board of Australia Code of Conduct outlines a large range of relevant legal implications, first of which is the most important being informed consent. The podiatrist must gain full informed consent from the patient before beginning their assessment and must be able to determine whether the patient they're treating has the appropriate level of education and ability to comprehend and understand the assessment adequately. Once the podiatrist is given consent and can begin the assessment, it's important to remember the scope of practice of the podiatrist that they're legally allowed to work within. For instance, if the podiatrist conducts their vascular testing and does find noteworthy results, it's important not to work outside the scope of podiatry and recommend treatments or ways to fix these problems, and to instead refer to a doctor or specialist. The Code of Conduct also outlines the specificities of documentation and says that the podiatrist must keep record of the assessments conducted and any findings, keeping the documentation filed with no identifying markings. In the case that any adverse events do occur with the patient during or as a result of the assessment, the podiatrist must be aware of their duty of care to the patient at the time and the legal implications if they have not conducted their assessment as outlined by the guidelines. Before beginning the vascular assessment, consent must be gained. You should ask your patient if you can test their vascular status, give them a reason as to why you're doing it. For example, if you want to gauge their healing potential to best determine how to treat a wound, ensure they understand the process, ask them to repeat it back to you if necessary, and after they agree, you can proceed. Next, you need to wash your hands using the 5 moments of hand hygiene, which are before touching the patient, before the procedure, after body fluid exposure, and after touching the patient, and then after touching patient's surroundings. After washing your hands, you need to clean the equipment that will be used, for example, the Doppler, using an iso wipe, which should be fine. After this, the personal protective equipment that you're required to put on for a vascular assessment gloves are needed, as well as an apron. The first part of a vascular assessment is palpating the pulses. The 2 main arteries in the foot are the dorsalis pedis and posterior tibial arteries. This can be done by using the 3 middle fingers to locate the dorsalis pedis on the dorsal aspect of the foot over the navicular bone and lateral to the extensor hallucis longus tendon. The posterior tibial artery is palpated just behind the medial malleolus. The pulses will either be present, weak, or absent. If weak or absent, then it is appropriate to conduct an ABPI. Now you may continue with the vascular procedure. You will need a Doppler, gel, and a sphygmomanometer. Patient must be resting supine. You place the appropriate size cuff around the area to be tested. You locate the vessel using the Doppler probe in the gel to find the best sound. You probe 45 degrees to the artery for the larger vessels. Holding the Doppler still, slowly inflate the cuff until there are no vessel sounds. You inflate approximately around 30 millimeters of mercury, slowly deflate around 2 millimeters of mercury per second, and listen for when the vessel sound returns. Look at the pressure value at the point the sound returns for systolic pressure. Take this measure on dorsalis pedis and posterior tibial of each foot and the brachial or radial artery of both arms. The arms with the highest pressure is used for the ABI calculations. And ABI calculations can be done for both pedal arteries, however, usually the highest ABI is used. To calculate the ABI, it's the highest ankle systolic blood pressure value divided by the highest arm systolic blood pressure value, and normally the ankle is slightly greater than the arm pressure. For the toe brachial pressure index, a small pneumatic cuff is placed around the digit under investigation, most commonly the hallux. The PBG probe is placed on the pulp of the toe. The cuff is inflated until blood flow to the digit is blocked, then slowly deflated. The pressure at which the pulse returns is obtained is the systolic toe pressure reading. Divide toe pressure by the arm pressure, and TBIs can be taken automatically or manually. With the results, TBI interpretation values are less established than ABI values, and cutoff values are used as a guide. Thank you for watching.